How about the photo? Photo you want?
Yes, of course. Yeah. Take as many pictures.
So first, take a copy.
Yes, please.
So even if the faculty is very old, we are very happy to have some new buildings. One you have probably seen just across the street, where the clinical department is located. And in this house here, in this building, there is the administration of the medical faculty, and we are very happy that we have this skills lab in this floor here. So in Germany, after school, after you've got what we call Abitur, in English it's A level. A level in English. You can apply for a place at the medical faculty in Germany. It's very sought for this medical profession. So we have 40,000 applicants, and we have only approximately around 10,000 places where students can come to the university. So in Germany we have 4 students for one place at the medical faculty, and in Leipzig we do have 300 medical students every year.
You mean the annual year?
Yes, annual year.
Around
300. Yes, for medicine, and around 50 students for dentistry. And the curriculum we have developed here in Leipzig is divided in 2 parts, or 3 parts. The first part is the basic science, biochemistry, biology, chemistry, physics, physiology, anatomy, and so on, which lasts 2 years. And after these 2 years they have to pass an exam, and then they will proceed to the clinical part of the studies, which takes 3 years. And the last year, the 4th year, then is sort of a practical year just in the clinic, you know. The 3 years after this first basic science year is sort of a mixture between clinical work, where we have the students on the ward, where they have some teaching, and we have also lectures for the students. And you will have some lecture halls in this building, in the building right at the front of this street. The one in the front of the street, who is guiding you through the. Probably you tell them to have a look in this Hörsaal, in this lecture hall, because the lecture hall in the front of the Liebigstraße, which is running just from this end to the next, it's very famous in Germany. It's an old lecture hall. And whenever you see a picture in a German newspaper where some students are shown in a lecture hall, it's very often, very frequently, this lecture hall in this anatomy building here in Leipzig. So maybe you will have just to peek in this lecture hall.
You say it's famous.
Yeah,
I can't understand. What is the point of famous?
Because it's sort of old-fashioned, you know. It's
old-fashioned.
Old-fashioned lecture hall, you know.
Very steep.
Yeah.
With the professor
Right.
way down, and the students sitting on a very high level on wooden benches.
Nowadays you are now used.
Yes.
Yes, it's still in use. Yes, it's one of the bigger lecture halls of our medical faculty.
Today can we have a look at the...
Yeah, probably. Yes.
Yeah, so please continue.
Yeah. So after they finished their time at the university, they have to pass a second exam, written and oral exam, and then they are qualified doctors. However, they have to proceed to the clinics to get specialized doctors. For example, internal medicine or ophthalmology or ear, nose and throat or surgeon or whatsoever. And depending on the specialty they choose, it will take another 5 or 6 years until they get specialists in surgery or in internal medicine or so on, and then they can decide whether they will stay in a hospital, work in a hospital, or whether they work as a niedergelassen practitioner, yeah, sort of specialized practitioner in a own praxis, dealing with outpatients. So this is, in short words, the German system from the end of the school until they finish their being specialized in whatever specialty they choose in medicine. It takes from the start of the study until the end of the specialization, it takes about 12 years. However, after they finished university, they earn money. You know, when during university they don't earn money usually.
Can I ask you about how much of the total amount of the money after the graduation usually the doctor?
In euros, it's around. Wie ist denn der Tarifvertrag? Approximately 4,000 euros, and then you have
per month.
Yes, per month, and you have to deduct the tax.
Which is a lot in Germany.
Is it correct for you, for every German doctor?
Well, you don't get a millionaire. You don't become a millionaire, but you can live and you can have a family and you can have a car and live in a flat. So this will be okay. But if you want to live on a higher standard, you have to earn some more money and you have to advance in the hierarchy of the clinics, or you have to go into the practice. Where you can earn more money.
Can I have a pause? I ask some question.
Yeah.
なんか質問ありますか
？2年基礎みたいなのやって3年ですね。だって一番最後はプラクティカルのことやって、それで出て3年ぐらい修行するんですか、やっぱり。ちょっと話が聞くまで。卒業して3年ぐらい。
4年か5年か6年。専門によって。
それによって違う。で、トータル12 years って言ってたんで、
そうですね。だから
それは学生と卒業して、
両方
合わせて12。だから日本だと6年ぐらいで会社に乗せに行くから。
日本と大変似てます。
似てますね。
この方は病気で、この方は健康で。Inside, all the organs are as in our organs. This one is normal. This one has a cancer, has kidney cysts, has ichogan, has all sorts of pathologies, and you can use a normal ultrasound. This is a very old one. To look inside. Yeah.
Kidney means jinzo.
Jinzo, yes. So it's. Would you like to have a look? I mean, you can have a look if you want to. どうぞ。やったことなくても。Just have to see if it's on. What? You can actually, here you have kanzo and then you have the gallbladder. Gallbladder. And then if you go further down, you can see the jinzo, kidney. Is this here? よくできてます。大変よくできてます。Yes, vena cava. And then you also, if you go to the central point of view, you can see the backbone. And you can see the aorta and the portal vein. You can see both kidneys. You can also see the, not so good. But maybe I can show you the pathology. You can see several metastases. Tain, eh? Yes, and these are very simple, but the students actually have the opportunity also to measure and to find out how they are located in the body. So this is these are very, very good simulators, and we are very proud because we are, from 2 universities in Germany, we are one that has these simulators. So they're quite frequent in the United States and also in Japan, of course, but not used so often in Germany. And Kyoto Kagaku also made it possible for us to do a symposium 2 years ago using these devices. So we are very happy to have a very good cooperation with this Japanese company. Simulator, but it has internal bleedings. And so it has internal bleedings like after a car accident. So you have all the internal pouches, Morrison pouch, you know, we call that Morrison. Behind the jinzo you have a little pouch, and that is filled with an echogenic mass, so it looks like blood. And we practice with our students how to localize this. And these posters are made by our students. We have 32 medical students who work as tutors. So we do peer teaching. We have students who learn how to teach other students, and they practice students with these models. And they make these posters for their fellow students, and they are showing you how to use the device of the ultrasound and how to position it on the body. So here you can see the jinzo that is actually from this simulator, and then they show you how to position the echocardiograph and the echo, and then you can actually see how the different cuts look like of the kidney. Slices, or this is here the liver again, the portal, cava, portal. And these are all Latin terminologies that we use, but they are the same in Japanese. Ventral and dorsal.
これが縦操作で、これがね横操作なんですね。
そうです。これ全部横操作でなんですけども、切り方によって画像が変わる。So we can only use them for ultrasound. They are not for pressing palpation. Yes.
Okay.
So I am not sure if Chibadai has these.
I'm not sure. This is the first time for me to have a look. Yeah.
They are very good.
Yeah.
These are Norwegian models, but we use them very, very often for basic life support and advanced life support devices. And what is very nice about the simulator is that we have a skill guide. So if you press too deeply, it will alarm. And if you
卒業前の
卒業前の
5年生から6年生
1年生から入ってます。
1年生から
本当に初めから入ってます。基礎の学生も来てます。ドイツのオランダの制度とちょっとだんだん似てきてるんですけど、Organ Based Curriculum って言って1年生から基礎だけさっきベアバイ先生がおっしゃったようなカリキュラムからちょっと離れてきて初めから実習で臨床の練習をしましょうということで基礎の学生も来てます。だんだんそうなってきてますね。だから少ないんですね。ドイツの36個しかないんです。
でも300アメリカ州でしょ。
こっち。でも私たちは大体ミドル。ミューニックとかミュンヘン。ミューニック。 これは廊下。こっちは若い人。
入れにくい。
入れにくいです。大変入れにくい。私たちの施設は3年前にできたんです。2年前にできたんですけど、まだ初めてに買った時のものです。だから別にメンテナンスなしでわっと置いておいてほったらかしって言ってどうぞみんな使ってくださいって言ったら大体半年でダメになっちゃうんですけど。
これはベニパンクシャー。ベニパンクシャーの練習。
ここに1個はこの液を入れて。で注射すれば血管が入ってます。で血管にちゃんと刺したら、もうここたくさん刺してます。
逆にするかどうか。
はい。
それで見ようね。メイドインジャーマニー。
This one is made in America. This was made in Japan.
アメリカジャパン。
いえ、これはイントラマスキュラー筋中。
大層なもの
当てないよ。
そうです。で神経の場所に当たっちゃったら音が鳴ります。だからこれもよく使ってます。これも結構高いんですけど、ちゃんと使ってましたら長持ちします。この皮も交換できますので、全体を交換しなくても皮だけ。
この上から刺すんですか？
まあここからね、ここの骨の場所をちゃんと確認して、3つの。
ドイツのイントラマスキュラーインジェクションはメインに。
もう最近はメインに整形の人だけ、オートペディックスウォードはやってます。普通はみんな
そこにやることもあるんですか？
あります。日本もやってますよ。They do the subcutaneous injection and the intramuscular injection. And then they practice, why do you do that? What do I need? What do I have to prepare? So they actually prepare the dyes and put everything on what they need, and then they check, is this really everything what we need, and how do we do it hygienically? 衛生の面からも。For 助産婦 Yes. And this is an English one. And you can practice actually how the child is born, the positioning of the child, and you can put this to a computer so you can actually invoke, for example, premature birth, and you can practice how you have to handle the child. So what we're doing now is we're starting interdisciplinary lectures and courses where we have medical students together with pupils from midwifery to practice this.
まだドイツでは監視分娩してるのかな？
いえ、使ってません。でも見せたいから置いてあります。こういうのを使った時がありますよ。昔はこれ。今日はこれ。
そうね。
Vacuum. This is vacuum. Very simple device and easy to handle. This is forbidden in Germany. Advanced level. So we actually practice that. Simple slides. And you can see the background of the eye as a slide. And you can use a normal ophthalmoscope, this is otoscope but with a different top, to look into the eyes. And we use these for our courses, and they are very, very popular with our medical students because they can usually not do so many ophthalmologic examinations on the patients in the clinics. So they can practice all sorts of retinal pathologies with the simulator. And this is the same device for the ears. Yes. No, he doesn't have any ears. This is Taro and Jiro. And Taro and Jiro have different ears. So we can actually put the ears in here. And then you can practice how to pull the ear. And you can have different pathologies depending on the number here. We have 20 different kinds of ears. with otitis, chronic otitis, acute otitis, and you can look into the ear with these devices. And so you can practice looking at the middle ear. So this is a simulator for checking the middle ear. And it is very frequently used in Japan. And in Europe, it's still not so popular. It's not so well known. Yeah? So we have lots of doctors coming from all over Germany who want to test.
What's the timing of how to know this dog?
That they're here?
Yeah.
Well, actually in Germany we have a skills lab network. And all the skills lab from our 36 faculties are in one network, and we meet regularly
and we
exchange information. And so if there are students from other universities who do tutoring in their skills labs, they come to our skills lab to check out these devices. So I would really like to do a cooperation like with Chiba or with a Japanese institution to exchange students who are working in skills labs. But so far there are not very many students who are actually working in such an institution in Japan.
How many medical staffs are there now working in this lab?
In the skills lab? Well, I'm the director of the skills lab, and then we have three more, but they're not doctors, they're technicians. So we have 32 medical students who do the didactic courses, and all the teachers, all the doctors from our university hospital come and give courses together with our medical students.
The main reason why I ask you because the ophthalmology or there are lots of questions the students ask.
Yes.
Resuscitation.
Yes.
All of the subjects we can answer. So.
Well, our main point is we are keen on doing it well didactically. Practice. How do you hold an otoscope? How professors can't teach them in the lecture hall because they're giving lectures. So here we do practical clinical
to the student,
practice.
medical student.
Yes. We do this on a lower level. The students would love to do it. Our German students would love to go to Chiba and see how it is working. But it is always difficult to get the organizational structure going. Yes, do you have any questions? You would like to go. This is our Koken room. So we do bimanual Kensa, and we also do the breast examination. This is also the Japanese Koken. It has cancer, but it also has lymphasen, which are hareteru lymphasen. So we can actually show our students how to feel the breast and do the mamma palpation correctly.
You mean the lymph node is tactile?
Yes, you have tactile lymph nodes here. There's a pretty big one here.